Welcome to the Trinity Health IHA Medical Group Wednesday Wellness Series. This presentation is titled Tips and Tricks for Helping Your Child Sleep, and the presenting provider is Trinity Health IHA Medical Group Pediatrician Jessica Lee. Dr. Lee sees patients at our Domino's Farms location in Ann Arbor. Welcome, Dr. Lee.
Thank you. Hi. All right. Thank you guys so much for coming to my talk on pediatric sleep. My name is Jessica Lee, and please feel free to write down your questions. This is going to be a pretty basic overview of pediatric sleep. And of course, you might have a lot of questions because I think sleep is one of those topics that's so difficult. Pretty much wherever you are in your child's life, whether a newborn all the way up to teenagers, I think sleep can be just one of those things that is difficult to master. It's definitely a skill that a lot of kids struggle with. And so no matter where you are in your journey, I'm hoping that you'll be able to glean some tips, some tricks, and potentially maybe information if you're thinking about talking to your pediatrician about sleep, on things we might do before you might want to talk to them, or if you do want to talk to them, when it would be kind of an appropriate time to do so. And so that's kind of how what we'll do, we'll talk about different tips and tricks, and then we'll go into sleep problems and then when to talk to us. And then, like I said, feel free to write down any questions, and then hopefully I'll be able to answer them. If I'm not able to, I'll be very frank with you, and I'll tell you that I'm not so sure. But I am more than happy to research further and get back to you if I am uncertain of an answer for you. Okay. So we'll go ahead and get started. So why is your child's sleep important? So this is actually just taken straight from the AAP, right from the horse's mouth, who they are kind of like the leaders of pediatrics. So they write that sleep is just as important to your children's development as well-being, and well-being as nutrition and physical activity. The amount and quality of sleep we have can affect our safety, how alert we are, as well as our memories, moods, behaviors, and learning abilities. So establishing good sleep practices while your children are young will not only benefit you, but will also help them for many years to come. A way to kind of explain that further, kind of more specifically, I chose to use like a study. So there was a study performed by the University of Maryland in 6 to 8 year olds that found that children who got sufficient sleep in that age group, defined as 9+ hours per night, had less mental health and behavioral challenges as compared to children who had insufficient sleep. When they talk about mental health and behavioral challenges in that age group, they're talking about things like impulsivity and stress, depression, anxiety, aggression, as well as like thinking issues. We also noted that there was impaired cognitive functioning compared to the two groups from insufficient sleep to insufficient sleep. And that was defined as like decision making, conflict solving, and working memory and learning. So all those things were seen to be affected in children that got less sleep. Interestingly, those differences actually persisted at the 2-year follow-up. And so we do see that the disparities that we see can often be persistent. Apologize, you can still hear that, persistent for a longer period of time as well. So this is just an infographic that talks about how much sleep we expect to see or recommended for each age group, depending on their age. So since we're focusing on pediatrics, we're going to go from teen leftward. So for newborns, we recommend 14 to 17 hours per day of sleep, including naps. And then for infants from 4 to 11 months, 12 to 15 hours per day, including naps. Toddlers from 1 to 2 years should be sleeping about 11 to 14 hours per day, including naps. And then for preschoolers, 10 to 13 hours per day. This is kind of variable in terms of if there's going to be any napping or not. It just depends on your child, actually, more than anything. And then school aged is 9 to 11 years, or 9 to 11 hours, excuse me. Those are 6 to 13-year-old kids. And then finally, last but not least, for teenagers from 14 to 17 years of age, we recommend 8 to 10 hours of sleep per night. So I have cut this talk into the same exact groupings, and we're going to talk about each of these groups, different things that we know about sleep, as well as different tips and tricks that we would recommend for each group. So starting from newborns and infants. Newborn and infant sleep pearls. Things to know about newborns, especially when they're fresh out of the womb, they have a very irregular sleep pattern. So you're going to notice that they're going to fall asleep and wake up almost seemingly at random. And it can be a little bit frustrating for a newborn parent because of that randomness to it. But do know and take heart that they're going to regulate that over the first few weeks. They will definitely start to develop more of a pattern as time goes on, and we'll kind of talk about that a little bit later. But just know that in the beginning, it may have none at all, no pattern at all, but it will get better in the first, like ideally, like 2 to 4 weeks, we'll start to see some patterning develop. And then as they get further than that, you will definitely see more of a day-night pattern, and then a more of a sleep architecture develop around 6 months of age. Other things to note is that newborns should be woken to feed every few hours until they show adequate weight gain. What that often looks like is actually dependent on your child. So I would actually talk to your pediatrician specifically about your child and when it's okay to start to liberalize their nighttime sleep, which means you may not have to wake them after like 3 to 4 hours. Up until then, we will continue to encourage that. But things that can affect when or delay when we'll say that it's okay to liberalize the nighttime sleep would be, for example, if your child's a premature infant or having trouble with weight gain. So I think sometimes we expect it to be like a certain number of months, we should be able to let the baby sleep through the night. But really, it's more dependent on who your baby is and what your baby's background would be. And how they've been growing and how consistently that's been seen in their well child checks. And so specifically for each of your newborns, if you have one that you want to know if you can let them sleep a little longer, talk to your pediatrician and ask if it's the right time, and they'll give you their insight on your specific child. Know also that it's developmentally normal for infants to wake multiple times through the night. I know it's really frustrating. I have a 6-month-old that currently is waking up 3 times a night. So I totally know how frustrating this can be, but it is still developmentally normal for infants to wake. And it can occur, they can still wake through the night up to we don't expect to see sleeping through the night until about 3 months of age. And if they do, great. And like I said, you should talk to your pediatrician to see if that's okay. But 3 months of age is earliest when we typically see them starting to sleep through the night, which often is actually only defined as like 5 to 6 hours per night. But it can persist until about 12 months of age, and it still can be normal. So take heart. So in that, if your baby is 11 months old and still waking once a night to feed, it can be still normal. There's nothing wrong with your child. They're just doing what is expected for their age group. But we can definitely optimize their sleep. And so how can you help your baby sleep? First, recognize when your baby is showing that they're tired, so sleepy cues, and respond by helping them to sleep. So they'll rub their eyes, they'll yawn, they'll have increased fussiness or more jerky movements. Some parents will note that their eyebrows seem to be turning a little bit red. Those are indications that perhaps your baby wants to sleep. So you want to put them down for a nap or put them down to sleep at that point and not to stretch them out too far. Another thing that you might want to consider if your baby is a newborn or early in terms of months is to swaddle the baby. It is thought to stifle the startle reflex, which often is something that will kind of wake them up when they move around too much. And then it also emulates that warm and kind of tight womb. So that often helps them to sleep longer stretches. But things to know about swaddling is that the AP as well as your pediatricians will recommend not swaddling after they start to see the first signs of rolling. That can actually occur as early as 2 months. And so the swaddling has a very limited time frame that you can utilize it. And then third thing would be to build good habits early. I'm going to go into that a little further in the next 2 slides or so. So just wait for that one. But the next slide is going to talk about the last point, which is to set up a very comfortable and safe sleeping environment for a baby to sleep. As we're pediatricians, we always talk about safe sleep. So an environment that is safe for sleep is for baby to be alone. So we do not recommend co-sleeping because it increases the risk of SIDS, asphyxiation, and suffocation. And then always on the back. So not on their bellies, not on their sides, because prone, which is face down, sleeping can often increase the risk of always in a crib or a pack and play or a bassinet in their and a firm flat surface. So we want there to be a snugly fitted mattress cover if they have a mattress in their bed, and then just baby in there. No inclines and no soft surfaces because all of those also increase the risk of SIDS and the risk of suffocation, unfortunately. And with soft surfaces, often there is the potential that baby will accidentally kind of roll down into a wedge or something, for example, like on a couch. If the couch is kind of softer, if someone sits on the couch, baby may accidentally roll into a wedge in between the cushions, and that can often cause what we call mechanical asphyxiation, which makes it difficult for them to take breaths in, and they will also increase the risk of suffocation. And so we recommend not sleeping on soft surfaces like a couch or a soft bed. Also, no bumpers, no blankets, no loose bedding, and no stuffed animals, also because it increases the risk that something will fall onto baby's face and suffocate them by covering their nose and their mouth, and they're not able to kind of clear that obstruction as well. All right. Um, Other tips to reduce SIDS risks are pacifier use. Pacifiers, this is also a choice. Some babies don't actually take pacifiers, and if your baby doesn't, that's okay. It's not necessary per se, but if you are interested in using a pacifier, it is shown to decrease SIDS risks. That's thought to be because the pacifier will, number one, not allow them to fall into too deep of sleep, but number two, is also thought to prevent the mouth from obstructing because of the location of the pacifier. And so that's something to consider, but also know that the AAP does not recommend using a pacifier until breastfeeding is firmly established if you're choosing to exclusively breastfeed. So you want to make sure that you have a good breastfeeding relationship and that you're not struggling with any of that before you introduce a pacifier, because sometimes pacifier use can increase difficulties when it comes to exclusive breastfeeding. Also, you want to avoid overheating the baby. So that includes not overdressing baby and not putting hats on baby as well. No weighted sleep items. So this has been kind of a newer thing, but I think in 2022, the AAP has put out a recommendation that we do not use anything that that has a weighted sleep sack or like stuffed animals. We should not put them in our cribs or on our babies to reduce that risk of sleep-related death. Exclusive breastfeeding is thought to reduce SIDS risk as well. So if you are breastfeeding, that is awesome from a SIDS perspective. So we would encourage that. And of course, if that's not possible, that's okay as well. And finally, room sharing until at least 6 months of age, but ideally until about 12 months is also recommended. And important to note that it is room sharing and not bed sharing. And so when we say room sharing, we're just saying essentially that you should be in the same room as your baby on your own specific surface. So you on your beds and the baby in their own crib or bassinet. So not sharing the bed at all. Okay. And I told you that we're going to talk about good sleep habits early from infants. And so we're going to go into that now. We want to help baby establish a good night and day pattern. You want to do this early on. And so it's just to kind of get them used to it. And that means that during the day, you want to keep your lights on and make sure that you have the usual background noises so that they know that this is a nap. That is going to be a shorter, less consolidated sleep. And then at nighttime, you want to make sure that the room stays dark, that maybe if you choose to have a noise machine, that will be going in the background, quiet and calm environment. And also when you're doing like nighttime changes, just so that you don't wake them up any further, you want to kind of just do everything in the light of a night light and not really interact too much with baby, mostly just stay quiet and just feed and change their diaper and put them back to bed to help them to really understand the differences between nap time as well as nighttime sleep. You also want to set up a bedtime routine early. They're still really young, so keep it simple, like a bath, a sleep sack, a book, and a feed. Or it could just be a bath and a feed, whatever you want to do. It's just to establish that bedtime routine early so that there can be a little bit more of a rhythm for baby to follow when the time comes. And once they're a few months old, this one's a really tough one. Practice putting baby down drowsy but awake. I've heard a lot of parents tell me that this is probably one of the most frustrating things to hear from anybody, a pediatrician, a sleep specialist. But it is something that we do continue to harp on because it is important to try to make a skill for the kid. I think the thing to remember about sleep is that surprisingly, it is a skill that we need to learn. And if we never give them the opportunity to learn it, it becomes difficult. And so we say that you should definitely, sorry about that, our lights went out for a second. I think I was saying it's really important to build the skill. And so if you give your child an opportunity to learn it, that's the best way for them to get that down. So our goal is for them to try to avoid learning to fall asleep with an association with like feeding or rocking. We want you to try to see if the baby is tired, just to put them on their back and see if they're able to fall asleep on their own. It's really difficult, but just try once a day, every single day, and see how they do. And eventually they might start to get it. Um, and also, just know that persistence is probably one of the most important things when it comes to building these sleep habits. So I think a lot of times we will try for a few nights and just give up. But remember, you can put them on their backs and put them down and see if they're willing to let you put them down for a little bit. And then, like I said, just give them the opportunity to learn it. And then once they're actually asleep, the other thing to do is to walk, don't run. So when it comes to babies waking up in the middle of the night, sometimes you'll hear them kind of cry out, and then often we'll just instinctively run to their bedside and try to tend to whatever need they have. But sometimes, if you go too quickly, they actually are not necessarily truly awake and they're still just kind of moving around in that active sleep portion. And so they actually might just fall asleep on their own. And sometimes we'll accidentally wake them if we get to their bedsides too fast and try to pick them up. So something that we sometimes will recommend is to instead just go a little slower. So once you hear baby starting to kind of cry out a little bit, watch them and see, are their eyes open? Watch them on the monitor and just see what they're doing. And then give them about a minute or two, or even up to 5 minutes to really see if they're going to be able to self-soothe and self-settle themselves down. And if so, then they fall asleep, great. But if not, then you can of course go to them and tend to whatever need they need. Okay. Um, and hopefully that will also give them the opportunity to learn a little bit of self-soothing as well. Next, we're going to move on to toddlers. For toddlers, these are ages 1 to 2 years. They need about 11 to 14 hours of sleep. I know we already talked about that in the infographic, but I just kind of wanted to rehash that. And preschoolers need about 10 to 13 hours of day per sleep as well. How do you optimize their sleep? So I know we already talked about bedtime routines, and you're going to hear me say it probably like multiple times during this talk. You want to establish a consistent bedtime routine. What that would look like for a toddler and preschoolers is a little different, and I can give you some ideas of what to do at bedtime for them. But also another thing to do is just to anticipate their needs and address them before putting them to bed. That can avoid any things that will delay bedtime. For example, sometimes toddlers will say, "But now I got a potty. Hey, mom, I need you to give me a drink of water," or uh, "Dad, I need another hug." And so they'll try to delay bedtime by having you do another thing, another thing. And so it's really important that we try to anticipate that they might do this and address those things early on. Sometimes that means that you'll put in some limits and some boundaries for them. For example, hey, if we're going to read 2 books before bedtime tonight, and then after 2 books, it's time for bed, just so that we know that we've already discussed it and it's a kind of set thing. And then we'll try to maintain that limit to know that they can't push it past it and it won't delay our bedtime if, even if they ask. The other thing is to build good sleep habits. I know we talked about that also with newborns and infants, but in toddlers, it might be trying to avoid having them fall asleep next to you as their way of falling asleep, because it will build that sleep association and they'll have difficulty sleeping more independently over time. And so trying to see if there's a way that we can slowly build a good routine for them to sleep on their own. And then if they're using a pacifier in their toddler years, to try to wean it if possible, because that also can become a little bit of a sleep association. And we'll talk about sleep associations a little bit later when we talk about sleep issues down the line. Possible bedtime routine activities for a toddler or preschooler is, of course, like a typical bath, lotion, PJs, brushing teeth. It can include like reading books, and if they have a lovey, which is kind of like their items that they use to fall asleep, you can prep for bed with them. That can kind of like help them to know that lovey is going down, so they should also go down for sleep. So you can have them pretend to brush their lovey's teeth, or tuck Lovey in for bed and read a story to Lovey as well. Or some kids like to choose a toy to take to bed. I have a 2.5-year-old as well, and he likes to choose different dinosaurs to take to bed with him. But he knows that once he gets to choose a dinosaur, it's time for bed. It's time for him to walk to his bed and lay down. And so hopefully, whatever you choose as your bedtime routine, you just have to be consistent about it. And then your child will kind of learn that those patterns are what kind of indicates it's time for bed, and hopefully will go along with it as time goes on. Next, we have the school age and the adolescent kids. So school age and adolescents, they are a particularly difficult group to get to sleep, mostly just because a lot of them are just not getting what they need. So this is a CDC infographic as well. It shows that 6 out of 10 middle schoolers are not getting enough sleep. So majority of them are not getting enough sleep at night. And high schoolers, 7 out of 10 high schoolers are not getting enough sleep. So 70% of the high schoolers that you know are not sleeping enough. They're supposed to get, for school-age kids, 9 to 12 hours of sleep per night, and teens are supposed to get about 8 to 10 hours of sleep per night. But like as I said, majority of them are not quite getting there. And so we definitely need to work with a lot of teenagers on this because most of, like I said, the teens are struggling. So how do we optimize their sleep? As I had mentioned before, keeping a consistent routine. In older kids, this can look a little different because it's not necessarily as easy to set a set schedule, like homework, things like that. Playtime, sports, they all kind of get in the way of like establishing a really, really consistent routine. But the one of the biggest things that we see is like a lot of variability in like waking and sleeping times, and that can often affect their sleep overall, especially on weekends. A lot of teenagers tell me that they will try to sleep around like 11 or 12 and then they'll wake up at I don't know, like 10 in the morning, and I think often that can affect their sleep because with that amount of variability, they're not able to build a very good circadian rhythm. And so their bodies don't quite know when to establish that sleep well. And so we actually recommend that you try to make them wake and sleep at the exact same times, even on weekends and even sometimes on holidays, to try to make sure that we are establishing a sleep routine that can be consistent through the year. Also encourage being active through the day. That's like 60 minutes. We recommend 60 minutes of physical activity every single day if possible. And so that can often get them a little more tired and ready for bed if they've been a little more active through the day. And last but not least, good sleep hygiene. And what that often looks like is using, oh, excuse me, uh, using your screens. Sorry, I apologize. I went the wrong way. Yeah. So using your bed for sleep only. A lot of teenagers, a lot of younger kids will sometimes use their bed for homework, or they'll be watching social media on their bed, or they'll use their bed just to kind of like lounge around and like read things or kind of just bum and just lay there for a little bit. But we want to try to use the bed for sleep exclusively. In addition, we want a cool, quiet, and comfortable bedroom. We want quiet, relaxing activities near bedtime. So we shouldn't be playing those like really intense first-person shooter games, or like shouldn't be doing like a huge dance party right before bed. You want to do kind of like a bedtime read, or listening to like calming music or something closer to bedtime. And then, as I mentioned, staying active through the day is really important. But the other thing to know about that is you shouldn't be exercising too intensely before bedtime, too close to bedtime, because that can lead to endorphin release, which can often make you a little bit too alert to go to bed as well. Also, we instruct kids that struggle to fall asleep to get out of the bed if they're not able to fall asleep within the first 20 to 30 minutes. Get out of bed, do something else, maybe read something, or draw something, or just get your mind off of sleep. And then when you're starting to feel a little bit more drowsy, try to go back to sleep and see if you're able to fall asleep at that point. And then last but not least, avoid caffeine, especially close to bedtime. So that includes things like sodas, coffee, things like that. Okay. Next, we have also limiting screen time. So this is part of good sleep hygiene as well. But screens are probably one of the biggest things that have become a bigger issue in more recent times, just because of the advent of smartphones and the like. And so a lot of kids, they bring their screens to bed with them, and they tend to, I think they call it doom scroll, where they just scroll and scroll and scroll, and then they find that the like 3 hours have passed and they haven't even realized that it's now midnight. So screens affect the amount of sleep in that they continue to stay on their screens for too long and then fall asleep much later. And it also affects the quality of sleep. The blue light from the screens affects the quality of sleep because it actually it disrupts your production of melatonin, but in addition to that, it makes you more alert. And so those together affect your quality of sleep, so that you're just not able to fall asleep the same way. You can also you want to avoid screen time about an hour prior to bedtime to try to reduce the effects of the blue light on your sleep patterns. And the other thing to consider, might be a little bit extreme, is consider taking screens out of your bedroom altogether if possible. So for your kiddos, That might mean that they take their phones, their tablets, their computers, all to like a table that you might set up as a charging station somewhere else in the house. They have to put all their stuff there at 8 o'clock, and then they can go and do things like read in their room or um, uh, I don't know, listen to like a old CD player if you still have those, something like that until they go to bed and then go to bed thereafter. But it will help to take out the temptation of staying on your screens for too long. Okay. The other thing that you might hear from teenagers is that they can't fall asleep that early. And actually, that is actually very true. After puberty, there's a slight biological shift in an adolescent's internal clock by about 2 hours. And so we see that melatonin release happens later in teenagers than it does in children and adults. So while we as adults might get tired around like 9 p.m., sometimes teenagers won't get tired around like till about 10 or 11. And so it's not actually, they're being very honest when they tell you they're not that tired yet. And so that becomes a little bit of a difficult thing because they fall asleep later. But in addition, if you look at their school schedules, they tend to be the earliest risers. So sometimes high schoolers, their school start time is 7 a.m. a lot of times, and some of them are in activities like marching band or swimming, and they can be up at as early as 5 o'clock. And so if they sleep at 11 and wake up at 5, they're only getting like 6 hours of sleep per night. And so there's a lot of things that prevent kids from being able to sleep, enough so that the American Academy of Pediatrics has started to advocate for later start times for high schoolers, to try to encourage that they're able to sleep more to help both with mental health and cognitive functioning, for high schoolers, to allow them to thrive as much as possible. But because this is a problem, just know that I mean, we have not as a society really set them up for success in regards to sleep. And so if we can somehow help them to really establish a good nighttime ritual to help them sleep as early as they can, it's probably the best thing that we can do for them. So we're going to go into like sleep related problems. The first being behavioral insomnia. I talked a little bit about sleep association. So that this means that sometimes these kids will need specific conditions to fall asleep. For some babies, it's rocking, or some toddlers, it can be rubbing their back. Sometimes it can be like a parent lying next to them, but they need these things to be done in order for them to fall asleep. And if that seems to be the case, then we actually we do recommend that you start to slowly remove those associations. Sometimes it means just that you would have one less thing per night. Like, let's say there's two associations. They like to be rocked and have a pacifier for the infants. Then you try to remove one. You try to take out like passies, or you try to take out the rocking. And then you try to put them on their back and see if maybe you can just get one association with just patting them on their bottom, so that it's a little easier for you. And then eventually start to pull that away as well. But we definitely behaviorally want to work on slowly removing associations if possible, in whatever way you feel appropriate. Sometimes if you feel like you want to do it a little bit more aggressively, you can just kind of pull it out and see how they respond. But others will do it a little more gently with, like I said, replacing with things that are slightly less invasive, until they're able to fully pull out. The other thing would be, the other type of behavioral insomnia is limit setting, and this is often seen in toddlers more than and school age children more than other age groups, and that's like stalling and resisting sleep. You want another story. I need to play a little bit more. I need more hugs. I need more kisses. I need more cuddles. And so in this one, it's also just mitigating that behavior early. And so I think we talked about anticipating their needs. And so anticipate that they might try to extend their bedtime a little bit. And in doing so, you want to just try to cut that off early, by saying, here, this is the limit, this is the boundary. So you like stories, and we will read this many stories tonight, and then this is the final one before bed. And that you have to hold that parameter for that child, to hold that boundary, so that they are able to understand that it isn't something that we'll just kind of give in with. And so definitely working on behaviors and making sure that we're putting in boundaries with our children will be really great. And then of course you can have a little bit of both, and in both of those, it would still be to work on those behaviors by slowly trying to rescind those things, or just setting kind of firm boundaries and sticking to them. The other things are parasomnias, and you might see these in older in toddler ages. In order to kind of explain what a parasomnia is, we're going to talk a little bit about sleep physiology in infants and children. What that means is for newborns, there are two sleep stages, REM sleep and non-REM sleep. The other names for REM sleep is active sleep and non-REM is quiet sleep. For newborns, they spend equal time in both stages and they cycle through those rapidly every 50 to 60 minutes through the night. That starts to become more of a adult pattern around 6 months of age. And so infants that are greater than 6 months will stop having that REM, non-REM sleep that tends to cycle like that. Instead, it will be replaced with a REM and a non-REM cycle that looks like an adult. So they have multiple levels of non-REM sleep, N1 through N4, and then they have a REM sleep. Initially, they start off in non-REM sleep, and then as the night progresses, they get into more REM sleep over time. And so you'll see that it's not a 50-50 split anymore after they hit about 6 months of age, and that as the night progresses, you start off with more predominant non-REM sleep with less REM sleep. And then as the night progresses, as they keep sleeping longer, that the amount of REM sleep increases and the amount of non-REM sleep will decrease. So a lot of the parasomnias will happen in the non-REM sleep. The first of the ones that we'll talk about is something called confusional arousals. And what you'll see is that it happens in kids about toddlers to 5 years of age. Usually occurs a few hours after falling asleep, but just as sometimes when they first wake up from sleep. And you might notice that they kind of seem like they're waking up really upset, confused, like not really sure what's happening. They'll cry and they'll appear upset and distressed, and they'll tell you to go away. And kind of push you away. They're not like very scared, they're just kind of upset. And this can last for 5 minutes up to 30 minutes. And they'll probably not remember the event at all, actually. We usually say just give them some time. The important thing to note about this versus like a sleep terror or a night terror is that it's not associated with intense fear. They may be upset with you, but they're not intensely fearful. And in these situations, often we just say, give it some time and just support them through it. Sit next to them, rub their backs, hug them, whatever you want. But once they're out of it, they may just fall right back asleep, or if they're just when they're first waking up, just give them the time they need, give them the space they need, and then they'll come out of it in just a little bit. Night terrors are kind of like confusional arousals, but happen a little bit later in terms of years. About 4 to 7 years is when we typically see these. And these occur in the first third of the night. And this is associated with being like panicked, very scared, inconsolable. They're going to be sweating, their heart's racing, they're flushed, and they may even actually like get out of bed and run out of the room. And you'll try to console them, but they may not respond to you. If anything, they may push you away and scream. And that they may even become more agitated as you do more attempts to calm them. And it's also characterized by the fact that your kid won't remember it happening at all. Usually during these, we always encourage you not to wake the kid up because that often can extend the period of how long it lasts. But in addition to that, it also makes them really confused when they do wake up. And so we just say, try your best to just sit near them, make sure that they're safe, and let it run its course. And they'll usually just go back to sleep on their own without any problems if you just let it run its course. So confusional arousals and sleep terrors occur mostly because for different reasons, including stress, sickness, or sleep deprivation. So you can try to prevent them by ensuring your child is getting enough sleep and there's not a lot of stressors. And if there are stressors, we try to reduce that stress as much as possible. But if you're definitely going through those night terrors and confusional arousals, remember not to wake them up, as we had already discussed. The other thing you want to try is to make a sleep diary. So that tells you like you're documenting when they fall asleep, how well they slept that night, how often they're occurring. And then when you get like a good pattern noted, if you're noticing they're not sleeping enough, then you increase the amount of sleep that they get by changing their sleep routine a little bit and scheduling it so that they get enough sleep. And then The other thing we would do is also, you might also notice that there is a certain time period where they will always have these events. Maybe it's around 2 to 3 in the morning. And if you notice that there's that pattern, you can also consider doing what we call a strategic awakening, which wakes them up just before the event occurs. And when you do that, you might be able to circumvent the event altogether. Some parents will go in like a half an hour before that they anticipate the event to start. And so they'll go in at 1:30, wake them up really quick, maybe take them to the bathroom, and then they'll put them right back to bed, and they'll hopefully not have the night terror that night as a result of that. And of course, if they're having night terrors and confusional awakenings, make sure that you create a safe child-proof environment, especially if your child tends to leave the room. So making sure that there's not any big tripping hazards on the stairs. There's no that like they can't get out of the door of like the front of your house. So making sure that you kind of set up the best environment for them, so that if they do run out of the room, that you have everything you need to keep them safe. Next, we have bedwetting. It's a common issue, and a lot of kids will go through it. But the other thing to know is that they will likely also grow out of it. So don't be too discouraged if your child is bedwetting. It is super, super common, and we don't worry about it until at least like 8 years of age. And so if your child is underneath that, you don't have to worry too much. Bedwetting can often worsen if their child is stressed out, there's some kind of a trauma or sickness, or they're struggling with constipation because the bladder is abutting your rectum. And so if you're full of stool, it pushes on the bladder, and then it doesn't help them to control it, and they unfortunately will wet the bed. It also is noted in families. So especially if a parent has an issue with bedwetting, or they tended to have bedwetting until late in their child years, you will probably be something that you might see in your own children as well. Um, Guidelines for helping a child with bedwetting is to not stress out your child. So not making a big deal out of it, aka like don't yell at them, don't get upset with them. Um, why did you do this? Nothing like that. Just tell them it's okay. It happens. We'll just work together to change the sheets, and then moving on and encouraging them to maybe drink more during the day and less at night. Have them go to the bathroom before bed to try to see if it will help with the amount of bedwetting you have. And then seeing if we just outgrow them. We want to give them time more than anything. And it just takes time for the brain and the bladder to really communicate well enough that the brain will wake you up to tell you to go to the bathroom. But it just takes, for some kids, years to kind of get to that point. So just being patient with them is really, really important. You may want to consider a bedwetting alarm. If it's getting to the point where you're really like getting frustrated and they're getting older, it's a little alarm that rings off if it starts to notice that you're wet. And so it'll help to build a stronger association with the brain and your bladder to kind of get that, hey, your bladder is full, now you need to wake up type of thing. Of course, if you're extending out your bedwetting beyond about 8 years of age, you may want to talk to your pediatrician at that point, and see if there's anything else going on. But prior to that, just give your child a little grace and a little time. Nightmares. So this one occurs actually in REM sleep, and that's usually in the final 1/3 of the night, because at that your REM sleep is a larger block of time. Um, the difference between, let's say, a night terror and a nightmare is that children will remember the contents of the nightmare. They will not remember any episodes of night terrors, but they will remember the contents of the nightmare. There's a lot less body movement during the event, so they tend to be still. And they're usually very anxious about what's occurring. And it can also be because they're in a period of anxiety that they tend to have more nightmares. And so, with nightmares as well, I mean, trying to get them to sleep well, getting enough hours of sleep will help with those things. And then, of course, trying to deal with any of their anxiety can also help to prevent nightmares. But a lot of times it's just kind of a time issue as well. Other things to know is obstructive sleep apnea. So, sleep apnea is when someone stops breathing when they're sleeping, often due to the blockage of the upper airway. It affects the quality of sleep because basically what happens is that because there's an obstruction here, you're getting less oxygen, and then your brain is your brain recognizes that loss of oxygen and will wake you up so you will take a breath. And so we have disrupted sleep when you have obstructive sleep apnea. In children, the signs of obstructive sleep apnea can be things like snoring or heavy breathing, which is the same for adults. The other thing you might also notice is mouth breathing. So when we say mouth breathing, it's like when they fall asleep in the car or something like that. If you notice that they fall asleep but they keep their mouth open and breathe really deeply with their mouth. And tilting their head back, that might be an indication that there is some obstruction happening there. So they're trying to position their airway correctly so they can get a breath in. Kids often also will have like a restless sleep when they have obstructive sleep apnea. And you'll also notice that they have daytime sleepiness despite getting like an adequate amount of sleep. So they're sleeping 9, 10 hours a night and they're still complaining that they're tired. You also might see bedwetting or sleep terrors of sleepwalking because that actually happens, as we had talked about before, when you're not getting enough sleep. And so when your sleep is not optimized, you tend to see these parasomnias happen. And so that could tell you that maybe there might be some obstructive sleep apnea happening because it's affecting their sleep, which is causing all of these other sleep issues to occur. And so if you have concerns about this, it's something to talk about with your pediatrician. They may recommend an evaluation by an ENT to check their adenoids and their tonsils, but they also might send you to a sleep specialist to maybe consider a sleep study as well. Another thing that is kind of on the newer end is the restless leg syndrome or periodic limb movement disorder. This is usually first noticed because they have difficulty falling asleep or staying asleep, or they're just restless throughout their sleep. They're constantly moving. And you see that when you like go on vacation with them and you notice that they just seem to be moving all around the bed. Often, it's not something that they will tell you right away. So kids don't often say like my legs feel funny when I go to bed. So it's something that you a lot of times we'll have to elicit from them. So we can ask them like, why are you having trouble sleeping? Do your legs, you can ask, does it feel like you have to move or do your legs feel uncomfortable or does something feel uncomfortable? Why are you moving a lot through the night? And they might tell you that there's like something wrong. Like they feel like their legs feel like itchy or funny or uncomfortable because restless leg syndrome is characterized by this discomfort in your legs that you relieve just by moving it, even just slightly. And it tends to be worse at night. And so if they describe something like that, you may want to consider talking to your pediatrician as well to discuss maybe some testing because it is associated with iron deficiency. And so you may want to consider doing some labs at that point to see if they have any problems with iron levels to see if that will help. We also, sometimes if we're really concerned about it, we'll consider sending you to a sleep specialist for a sleep study because they will also track the movements and see if they truly think that your child might have restless leg syndrome as well. And so definitely if you start to notice like a lot of restlessness in sleep, it's something to consider talking to us about further so we can send you in the right direction and help you if that is what they're struggling with. When to seek help for sleep. Other things that you want to talk about, because we already kind of talked about different things that might require a referral or something like that. Some things to think about: a sudden change in your infant's typical sleep pattern or your child's typical sleep pattern. So sometimes parents will tell us that the reason that they came in is that their child is usually someone that sleeps through the night, but for the past 2 or 3 nights has been waking multiple times. And we'll check everything just to make sure everything's okay. And it might be that they're sick, and often it can be like something like an ear infection or something that makes it painful for them to sleep or uncomfortable to sleep, especially while lying flat. And so, if you don't have a good cause for it and your typical sleep pattern is off, then you can definitely come and seek us out so we can make sure that it's nothing that is something that we can do something about. Um, Persistent issues falling or staying asleep despite optimizing sleep hygiene is another reason that we want to talk to you. It could be because of obstructive sleep apnea. It could be because they're having some issues with like restless legs, as we had talked about. And so all of those things are things to consider. And then questions about sleep disorders. Let's say you're having problems with night terrors, then definitely, and you're trying all these things and it's not getting better, definitely talk to us so that we can help you and even consider sleep referrals for you as well. And then, of course, if you have any questions about getting your baby or your infant to sleep better, definitely talk to your pediatrician. We have other tips and tricks that we would recommend or try for them. And remember this, that sleep is a skill. It is something that is learned. It is something that you work on. Just be consistent. You make a routine, be consistent with that routine, and don't get discouraged. It will eventually get better. just try your best to set up a good a good algorithm for success, and hopefully you'll start to see improvements in your child's sleep as a result of that. I will take questions now, but I actually already have some. And so I'll start with the ones I've already had. And then, of course, if you have any, please feel free to send them now. If there are things that we didn't get to talk about, but you still have questions on, don't feel limited in sending those either. You can send those and I can try to answer any questions that you might have. Of course, my lights went out. All right. Yeah, so it says my 2.5-year-old is going through a sleep regression, taking 2 hours to fall asleep, even though she's showing signs of being tired. Previously, would be able to leave the room with her awake. Any tips for helping her relax or sleep? So it might be that your child is kind of wanting to extend out their their sleep schedule. So if they're taking 2 hours to fall asleep, number one, I would reassess the sleep schedule. So see if they're getting enough time in naps, if they're getting too much daytime sleep, because that sometimes can affect their nighttime sleep. So see if maybe you need to, depending on how many naps they're getting. Usually at 2.5, they're only getting about 1 nap per day. But if it's too long, it might also affect their nighttime sleep, so they're not as tired at bedtime. So reassess their sleep schedule. So check their nap times and then check when they fall asleep. Let's say you put their bedtime at like 7 o'clock. You may want to try pushing that to like 8 o'clock and then changing their wake times if that's possible for your schedule, and seeing if that might make things a little bit better. Um, and it's great that it sounds like she's able to fall asleep pretty well on her own. The other things that you might want to do is, of course, just kind of go through that routine. If you already have a good routine, just try to stick to it and kind of encourage her to follow it, and hopefully it'll help her to fall asleep better. The question of melatonin sometimes comes up. We don't typically, lately, we haven't really been recommending melatonin that much because it's not FDA regulated. And so if you are thinking of melatonin as a possibility, we would definitely talk to your pediatrician specifically for your child and to see if we would recommend it for your particular child in your particular case, because melatonin has some limitations in what it's able to do for us. And sometimes if the issues are not necessarily related to sleep onset or melatonin release, it might not help. Okay. Um, all right. Can you talk about how to set boundaries and how to get the kiddo on board? It just screams, and I feel like it takes longer for him to go to sleep. Yeah. So I think often, unfortunately, with sleep, it can be a bit of a battle, especially in the first portion. And so I think one thing that we say is like be consistent. And so when you set the boundary, it means that you have to stick to the boundary, even if they get really upset. And there's going to be a few really, really rough nights where they're going to really push to see if they are going to get their way. And often, if they make a big enough stink, we'll usually give in. And they will, unfortunately, then learn that they can push harder and harder until we'll give in and they'll be able to extend out their sleep time. So I would tell them, you can make a chart with them about like their nighttime routine, and then set that boundary with them. Hey, we need to stop here. We are doing XYZ. This is on the routine. This is what we made. So some parents will put like a chart up with like pictures of what they'll do. They'll put a picture of a book, and you can even have them be the one to decide what their routine is going to look like that day. And so like they can stick up a book, and then they can stick up like a lovey, and then the brushing their teeth. And so they feel like they're involved a little bit, but at the same time, it's the same similar events so that they know that that is their bedtime routine, but also feeling like they get a little bit more independence in choosing what they're doing, and then seeing if that would help. Because often, a lot of times, toddlers just want that a choice, and they want independence, and they want to know that they have a say in things. And so if maybe you give them independence in a different way, it might be able to help you. And also maybe if you're choosing a book, you can have them be the one to choose it, and they choose like say two or three, and you say this is as much as we will do. Or if it's a playtime issue, they can choose two or three things they do before bed, and that those are 100% their choice. But then after those things are completed, you stop there and you just have to make that boundary stick. All right. Any suggestions for a toddler who will lay there restless instead of falling asleep? Different bedtimes, following tired signs that this has been this way since we took the pacifier. Um, oh goodness. Okay. Uh, yeah. So, the things that it sounds like you're doing with your 22-month-old, it sounds like, just to kind of give a quick overview, will tend to lay awake for at least an hour. They've tried many different things, different bedtimes, following sleepy cues, and sometimes like she will do certain behaviors that will prevent the parents from leaving, and tends to put up a little bit of different excuses to provide to extend out the bedtime. So in these situations, you can try sleep training. And that honestly is a lot of times whatever you want it to look like. It sounds like you're using the chair method, which is to sit in the same room next to the child and slowly pull yourself further and further away, so that they know that you're nearby, that you're there and available to answer their needs. But it's not as intensive as something like a cry it out method. But it sounds like you are doing kind of a type of sleep training, and so I would try doing different methods of sleep training, whatever's comfortable with you, and trying to see if that might help. It sounds like right now the chair method has been somewhat successful, um, but I would see if we can get her to eventually um, just learn that this, like her kind of engaging you guys, isn't really going to help. And so, whatever that might look like, and whatever um, whatever that might feel appropriate for you, would be, I think that would be how you should address it. I mean, definitely. If she's bashing her head on the wall or the floor, definitely try to make sure that you set up a good sleep environment in terms of like making sure that she won't probably hurt herself that much, because most children will do things enough to get your attention, but not enough to really hurt themselves. Um, but I would try your best to let her know that those things will necessarily delay the bedtime. And so establishing like good parameters, and this is the end of what would let you do, and then kind of holding that line and just continuing on with the sleep training method that you've chosen would probably be the best thing. Um, Okay. And it sounds like we have like a thumb sucking sleep association. So sometimes different people will try different things with thumb sucking. Some people will try like like a nail lacquer or like a nail polish that tastes really bad, so that they won't thumb suck anymore, because it will just push them to try something else. It sounds like even if she's not doing it and you tell her not to, she'll stay awake until you allow her to. So it seems like the thumb sucking has become a little bit of a sleep association. And so if you can try like reestablishing a different sleep association, that might be helpful. One that's a little less invasive and a little less difficult, or like um, a little less trying on the thumb, because with the thumb sucking, you can definitely get like a little bit of swelling and irritation of the thumb. And so maybe giving her something else to get an association with, whether that means I'm not sure how old this child is. If they're old enough, maybe considering like introducing a lovey of sorts, to help her with the naps and the night sleeping, might be a good thing to kind of give her something to calm herself with, but that is not detrimental to her thumb itself. Um, and then nighttime coughing issues constantly. Uh, Reflux can cause nighttime coughing. So I would definitely talk to your pediatrician specifically about nighttime coughing issues, because asthma is definitely a possibility in this situation. Is it always asthma? No. And as you had mentioned, reflux could be a consideration here. But other things can cause a nighttime cough as well. Allergens in the room, the sleep environment itself. We would probably have you guys talk with us and see, like allergies in general can cause like a nighttime cough as well. But it's definitely something that we would want to talk to you about in specific with your child, and see different things. We can trial different things and see if we can find a way to decrease that nighttime coughing, because it definitely does affect sleeping overall. Um, So waking up with nightmares, the first thing I would say is make sure that they are truly nightmares. So if they're nightmares, they will definitely remember it and be able to tell you exactly what's going on. This is what I remember, or this is what I saw. But a 2-year-old sometimes will have like a a confusional arousal as well, or innate terror. And so if that happens, it's definitely to encourage how to to encourage sleeping a good amount of time because often it's a lack of sleep that's causing it. And then definitely, if it is a nightmare, often it's tied to like anxiety or feeling anxious about something. So trying to reduce stressors or things that will provoke anxiety can definitely help with nightmares as well. Um, if it's a confusional arousal, like I had mentioned, like they're not remembering these events and they are happening early in the evening, you may want to consider also waking them up before it happens. And that might prevent like a confusional arousal or a night terror. And then, of course, reducing stressors and allowing them to sleep enough will also help decrease your night terrors as well as confusional arousals. Nightmares are a little harder to manage because it's harder to prevent them per se, but definitely reducing anxiety can definitely help with that as well. Um, is it true that giving melatonin decreases your body's own production of melatonin? I'll be very honest, I actually don't know the answer to that. I I'm not 100% sure if that actually happens. I can get back to you if you want to leave your information in the chat. I can definitely get back to you and let you know a little bit further about that after researching a little on my own, or you can always call our office and I can you can send on your information and I can answer that question more specifically. But I have to be very frank, I'm not 100% sure about the answer to that. Um, my 8-year-old daughter has never been a good sleeper. All right. Okay. So, yeah, if you're really struggling with your older children and getting them to sleep, the question then becomes like, what is necessarily causing it? And if you have not yet talked to your pediatrician, I would at this point, because it sounds like you've done a lot of different things to try to help with your child's sleep. So I would say that for older children that are like school aged and you've kind of optimized your sleep hygiene, you've optimized like your sleep scheduling and making sure that you've kind of instilled all those good habits and we're still not quite getting there, then I think it deserves to be dug in a little bit more. So I would maybe talk to your pediatrician at that point. And there are good sleep psychologists that are a consideration in the community that you might want to consider getting a referral to, or they may not even require a referral. Um, just depends on who they are. And then also just, yeah, like I said, talking to your pediatrician to see if it's a behavioral issue or if there's something pathologic underlying that we might need to address, whether it's like we had talked about restless leg syndrome, or if they're obstructing in the nighttime, or like, because a lot of times with not falling asleep, it can be that they're just feeling like they have the jitters, and that can be the first signs of restless leg. And so I would talk to your pediatrician and see if you can hash out the difference. If it's in a behavioral insomnia, sleep psychology might be helpful in this situation, or if it's something more pathologic that we might be able to address, that's something that we might want to try to do. Um, uh, the next question I had is about maybe changing routines every few days if this is particularly horrible for a child. It's really tough when they're in different homes to manage when it happens in another house. And I think you're not going to break the bank per se. I think it's really important that you try to get on the same page for different reasons. I definitely would consider bringing, if you're able to come to the same appointment with mom and dad together, it might help when they hear it from someone else that isn't necessarily the other parent, especially if maybe there's a contentious relationship between mom and dad, to bring them to a third party, the pediatrician that might be able to rehash, hey, like it's really important that we have a set bedtime routine. And also just kind of making sure that your child is aware that they should try to stick to their routine as well, depending on their age. It's hard to know. I don't know how old your kiddos are. If they're younger, it's hard to make sure that they do those things. But if they're kind of on the older end, like if they're in their teenage years, you might be able to kind of rehash out the importance of sleep for them and trying to make sure that they try to hold on to their routine when they're at different homes as well. But I think the easiest thing to do is definitely bring in a third party that is not necessarily involved, that is completely not involved in the situation, and have them put in their 2 cents about making sure their routine is stuck to so that they can get the best sleep they can try to get.
And
Uh,
Dr. Lee, I wanted to ask on just to piggyback off of that, could you create a chart that could kind of travel with your child? So where you said they pick their routine, maybe it's okay if it's not the exact same every night, but then you still are holding that chart as something that they're seeing every single time they go to sleep.
Yeah, I think that's great. I mean, if you want to make like even like a time chart, that might help. Of like at this time, we'll try to doing XYZ so that they can kind of follow through with those things. And then I think as you start to see more improvements, when it comes to like different homes and having difficulty maintaining a good routine in the two homes, is maybe for that other parent to see the benefits of what they're doing. So if you have that set routine and they see that, oh, the child sleeps a lot better while they're here and they're in a better mood and they're maybe not as aggressive or not as their behaviors are overall like better and less tantrums, XYZ, whatever they're starting to see. If they start to see those benefits, they might be more willing to be on board with the whole routine scheduling type of thing. And so I would maybe have them like try it out, like maybe, hey, write out what you typically do. And you can even let the child, like as we had talked about, choose their kind of small details of what their routine would look like. But if they kind of stick to that and they see an improvement, you might have a little more buy-in from a different parent that's maybe not as open to it initially.